In this video, I'll be talking about sleep problems and sleep disorders. And our first sleep problem that we'll be discussing is insomnia. And this is a consistent difficulty in falling or staying asleep. And so we're unable to fall asleep if a person has insomnia. This is one of the most common sleep disorders. And people experience long delays between their sleep cycles. And people may experience increased levels of anxiety about their inability to fall asleep. And they can become really anxious, which just feeds into not being able to fall asleep. This is what a person may look like, or an example of someone suffering from insomnia and trying to go to bed, but maybe they're really anxious, and so they're unable to fall asleep, or they have insomnia and have the sleep disorder. Some treatments of insomnia include the use of stimulant drugs, such as caffeine. This includes increasing your physical exercise during the day to make the body tired and to try to force the body to get tired so it can fall asleep. And then also sparingly taking over-the-counter medicine or medicine prescribed from your doctor could help with insomnia. As well as cognitive behavioral therapy, in which a person tries to change their thoughts in order to change their behaviors, and hopefully changing your thoughts. And if a person has a high amount of anxiety, they can maybe work on that in order to behaviorally start to fall asleep again. And then there's other stress management techniques that a person could utilize in order to treat their insomnia. The next one is a collection of sleep problems and disorders called parasomnias. And this is a group of sleep disorders in which unwanted, disrupted motor activity and or experiences during sleep play a role. And this can include sleep problems or disorders in REM sleep or non-REM phases of sleep. And so the first is sleepwalking, and sleepers often have their eyes open and they're physically conscious, but maybe not mentally conscious. So they're not responsive to attempts to communicate with other people. And people most often, or people who have sleepwalking, most often occurs during the low wave sleep. So the beginning levels of sleep, stage 1 and stage 2. But it can occur at any time during a sleep period in some people. It can be treated with some pharmatherapies, so in a collection of different pharmaceuticals and drugs, as well as therapy. Another parasomnia is REM sleep behavior disorder, or RBD. And this occurs when the muscle paralysis is associated with the REM sleep phase do not occur. And high levels of physical activity during REM sleep. And this can include kicking, punching, scratching, yelling, or behaving like an animal or anything else that has been frightened or attacked. You could injure your sleeping partners or other people if you have a combination of sleepwalking and this RBD disorder. And people, like I said, who suffer from this disorder can often injure themselves or their sleeping partners. And next, we have restless leg syndrome. in which people experience uncomfortable sensations in their legs during periods of inactivity or when they're trying to fall asleep. And this is discomfort, and this discomfort is relieved by deliberately moving the legs, which also consequently contributes to the difficulty of falling or staying asleep. And there's a wide variety of drugs that a doctor can prescribe to help someone with restless leg syndrome. And the next parasomnia is night terrors. And this is a sense of panic and often displays screams and attempts to escape from a person's environment. And people generally have no memories of the event that occurred during a night terror. Any attempt to console them or offer help are mostly ineffective. And then most often, people will fall back asleep again within a short amount of time after a night terror. Moving on, we have sleep apnea, which is when a sleeper's breathing stops. These episodes can last between 10 to 20 seconds or even longer, and are often associated with brief periods of arousal and wakeness. And these people experience increased levels of fatigue, so they're really tired. Individuals snore loudly or stop breathing for extended periods of time while breathing. And sleep apnea is much more common in overweight people, and it is often associated with loud snoring. So just imagine if you're somebody's partner who has sleep apnea, they're sleeping next to you, they're breathing, and then all of a sudden their breathing stops for maybe 10 to 20 seconds, which can be really scary if a person doesn't know if they're about to breathe again. And so sleep apnea can be really scary, especially when we're not breathing with our lungs while we're not conscious. Sleep apnea can include obstructive sleep apnea, which occurs when an individual's airway becomes blocked during sleep and air is prevented from entering the lungs. And then there's central sleep apnea, which is a disruption in signals sent from the brain that regulate breathing, and this causes periods of interrupted breathing. And some treatment of sleep apnea includes continuous positive airway pressure, and this is a device which includes a mask, as you see here, that fits over the sleeper's nose and the mouth, and it's connected to a pump that pumps air into a person's lungs, forcing the lungs to remain open and helps the person breathe. Next, we have sudden infant death syndrome, or also called SIDS. This is when an infant stops breathing during sleep and eventually dies. This often occurs in younger infants, who are under 12 months and appear to be at the highest risk for SIDS. Boys often have a greater risk than girls, and risk factors for SIDS include premature birth, if a parent smokes in the home, or hyperthermia of being too cold. And some treatment for SIDS includes infants should be placed on their backs when sleeping. Their cribs should not contain any items where the infant can suffocate and not breathe. And infants shouldn't have any caps or hats placed on their heads when they're put down to sleep in order to prevent overheating. And also, people in the child's house should not smoke. And also, we have narcolepsy. This is when we fall asleep at inopportune times. if a person has narcolepsy, such as in like a business meeting and they suddenly fall asleep. And these sleep episodes are often associated with cataplexy, which is a lack of muscle tone or muscle weakness. Narcoleptic episodes take on other features of REM sleep, and these episodes are often triggered by states of heightened arousal or possibly stress. And a typical episode of narcolepsy can last from a minute or two to half an hour. And then once awakened, people report that they feel refreshed and report that the sleep, even for a minute or two or half an hour, refreshed them. And these episodes can really interfere with our ability to perform different tasks in one's daily life, especially like this person, as you see here, if they're in an important business meeting and suddenly fall asleep. This really hinders their performance at their job. And narcolepsy can be often treated with stimulant drugs, such as amphetamines, prescribed by a doctor. And in our next video, we'll be going over amphetamines and other substances that we may use to affect our consciousness.